we build a HUMI project? We're not going to go through the details. That's something we've got to work out. The first one is that we have to collaborate, and that's nothing new to anybody working in this sector at all. And indeed, it was really heartening to hear Simon talk about the systems approach. I think we're dead in the water unless we do that. And our particular ecosystem that we want people to work in is community, which you're really familiar with, local government, and the health system. And that might be a little bit harder than it sounds. Now, HUMI's competing, or any intervention that has those three communities is competing with a lot of different agendas and issues. And you really do have to sit down and map out all the issues that are involved in doing what you're trying to do. Creating a biodiverse urban green space sounds easy, and most communities will just get right to it, but unless we've got the local government involved, it's never going to be sustainable in that environment. And unless we have the health sector involved, we're never going to have an evaluation and a buy-in. We'll lose that hook. So really critical that the collaboration starts out with a systems approach right from the word go. The second one, and sort of a follow-on from that, is this developing of a shared understanding. I have hard enough time understanding my colleagues when they start talking about immunology and microbiome science. When we're working with these communities, it's not just about research. And in fact, the research is important, but it's the health intervention that we're making by using the biodiversity, that's what's going to make the difference. Clearly, that's the difference to make. The research is an ability to have a participatory basis, community-based research, where they can be part of trying to understand how much this is important. What is the dose response in their patch of the world? And the third one, and again, I really appreciate Simon's presentation, is evaluation. If we don't do that, we're never going to convince the health sector, the health system, that a reallocation of resources, any resources, is worthwhile. And I said the third thing is be transformational. It was wonderful to come to COP14 and actually hear people talking about transforming the way you do things. Transforming isn't about an incremental doing better. It's about looking for a different direction to head. And you might be surprised to hear that's what the words that they're using in the UK health system and other health systems these days, because they've run out of road. There aren't any more medicines, we're running out of antibiotics, we can't treat the obesity epidemic. There just isn't enough money in the system to treat the end of somebody's life course for all these conditions. We have to get in with more and better interventions earlier in the life course. Biodiversity seems an ideal one that hasn't been exploited yet. So to be transformational, we really do need to work in a new and different collaborative group space, local government, the health sector, and communities. Another very important component of this approach, the HUMI approach, when you start to talk about people, let's talk to people in your city about this, is that there are many co-benefits to having biodiverse urban green space. We have thermal buffering, it's a climate change issue. We have social mixing, so that's a sociological issue, reducing stress. We have calming environments. There are so many different aspects of green space that makes this no downside type project, with the potential of actually being involved in the first wave of something new. So if you're interested, get in touch with HUMI. We've got a website now, and over the next 2 or 3 months, we're going to be developing detailed templates, guidelines that will allow cities to develop their own project. So I said I would introduce the rest of the team. So we have had 3 years working in 4 pilot cities. Adelaide, Australia was the origin. Adelaide University has been the science driver behind everything. And Professor Phil Weinstein, who was really one of the movers of this and is still involved in the project, he was very sorry that he couldn't be here this week, is one of the co-PIs with Martin on the science and the public health side. Haiku China and the Chinese Centers for Disease Control, Professor Qiong Liu is also another very early adopter and keen participant in this. And they continue to participate. Again, he had other commitments and wasn't able to be here today. The third city, sort of where Dave Phillips and I are hailing from at the moment, Bournemouth, UK, provided the third site, and we've got the health sector there involved. Now, Public Health Dorset and the Clinical Commissioning Group that Dave is now working with have now formed a new ecosystem, part of the transformational change in the United Kingdom, the first 12 of the integrated care systems for the United Kingdom. And this is going to be one of the showpiece projects in terms of involving the wider determinants of health. It's worth reinforcing what David said earlier, and that is that in the health sector accounts for about 20% of somebody's health expectancy over their life course. That means about 80% of what makes you healthy lies outside the realm of healthcare services, right? So there's huge potential for things like biodiversity. The fourth city, Delhi, India, was quite a real challenge. You were there during the air pollution crisis when you were sampling. And our partners there are the Public Health Foundation of India. They ran into a visa snag, or they would have been here as well today. In the bottom left, our university partner in the United Kingdom is the European Centre for Environment and Human Health, and they're at Exeter University in the School of Medicine. One of our early supporters in the health sector was Dr. Chris Skelly, head of health protection for the South Australian government. And the green logo, which is very hard to read, I'm sorry, our partners again from China is the Institute of Urban Environment, Professor Zhu, the Chinese Academy of Sciences. And again, these people are very busy and they had other commitments. And we've also recently, one of our former students is now working at the University of Tasmania, Emily Fleece. She was here earlier this week but couldn't stay till the end. So we'll leave you with the HUMI 2020 challenge, which was covered in the explainer. For 3 years, we've had 4 pilot cities that we've sampled and started to work with. We need to accelerate that now, and I'm hoping that our partnership with the Secretariat for the Convention for Biological Diversity will give us this launching point so that we can bring this big time. Now, in our side event, we thought, wow, 20 cities in 20 different countries by this next meeting, COP15, was really reaching. Then there was a voice from the EU that said, why not 200? Yeah, why not 200? We have to start somewhere, roll it out, spread good practice, and that's what our intention is. So, I'm finished with the formal speaking part. We do have time for a few more questions, I believe. David?
Thanks very much for all of that. That was great. And just a few thoughts and questions now. Happening just a few meters away from here is the 6th Global Biodiversity Summit for Cities and Local Government. So I want to introduce you guys to some of the people there.
Okay.
As you say, one of the key components there that we need to mobilize is civic leaders, city leaders, and the like, alongside the public, general community, and alongside the health services. And on the health services, I just have a question for you is, particularly for you, David, in terms of how much traction are we getting in the health services in various countries on this issue? Obviously, it's an issue that's been emerging over the last few years. The evidence is basically getting stronger and stronger as you presented. How much traction is there? And also, what tends to be the response of the health community and the broader medical community? Because when you look at the papers in the journals on this issue, there are some that are talking and taking this sort of more holistic approach, if you like. Yeah, let's just increase more biodiversity, then we'll have healthier microbiomes, healthier people. And then you also see the sort of more reductionist approach of saying, okay, we just got to figure out, which of those bugs are really important, and then we'll transplant those. Which path are we going to go down? Or probably, perhaps there's room for both, but it'd be good to get your perspectives on that. So a couple of interrelated questions.
Yeah. David, do you want to take the first swing at that?
Sure, I'll start on that. I think that the history of getting traction with the health sector is patchy, really mildly. I think where we have had traction, it's predominantly been around the health protection arena, around specific organisms, around antimicrobial resistance, around issues like that. So I think there is a long history. That would, though, in many people's views, fit into the public health arena. I think getting traction with the healthcare provision setting is a different agenda altogether. Having said that, the point that Chris made about the lack of progress with non-communicable disease, as illustrated there, is being reflected, and also the ongoing impact of the post-2008 austerity. There is no more money. And health sectors and healthcare sectors are being forced to do things differently. So in many countries around the world, so certainly in New Zealand, in Europe, in America, and now in England, they're talking about integrated care systems. And interestingly, what I didn't mention there was there are good examples around the world, where, especially in indigenous communities, so in Alaska and in the Maori community in Western Auckland, where they've developed different systems of healthcare, which reflect far more local values, and they are funded by the healthcare setting. So I guess the reason for saying this is there is an opportunity here for us to start a different discussion. Now, when the National Health Service in England, which employs 1.5 million people, starts having as its two cross-cutting priorities that are coming out next week, a life course approach and inequalities, I just see that as a huge opportunity for us to sort of embed biodiversity and related issues into the agenda. So there are no more, the drug bill for diabetes in England belongs to somewhere £1.5 billion a year. That's just not sustainable. So we're at an interesting turning point, I think, and so I just think there's a large opportunity there, and this is a global movement around integrated care. We need to be part of that discussion. Do you want to? The second stage was around pathways and things, and perhaps I can pass on to Craig or.
I guess on the mechanisms, are we interested in microbial diversity versus a particular, they call them microbial old friends, the sort of particular organism. I think we're interested in the right mix of both. So in particular, I think they started looking at, can you put an organism in a pill and give people a pill to solve their problems, and I don't think that's working out very well to my knowledge at the moment. But I think there's a good theoretical basis for some of these microbial old friends and the molecular patterns that they provide in these signaling pathways, for them to be in a mix, in a diverse mix of a wider community. Because any particular organism might become pathogenic if it gets out of control in terms of numbers. So you need that diverse community to keep any particular organism under control, but have the sort of organisms there that we're used to being exposed to from an evolutionary point of view.
Yes, Simon.
Well, thanks for great science reading, and I'm really happy to see this happening and at that kind of level of investigation. But I'm still quite worried. I'm coming from the veterinary field, and we tend to be very advanced in segregating populations into isolated units, and the biosafety is basically the basic approach that we do. We basically say if we can cut out any kind of microbe out of our production system, we make it a safer place, and actually a better place. So it's kind of a challenge to your approach, which I can see from a human health perspective. We can't lock up people into confined spaces with air filters. But I mean, as a veterinarian, I would prefer to see animals also a bit less confined. So I would like to hear your ideas about these contradictions between these two narratives, basically. And obviously, this is a new narrative that needs to make ground.
Absolutely, we're discussing this. Who would like to tackle this?
I think there's an analogy there with the typical hospital situation where the only good bacterium is a dead bacterium, and you basically wipe things clean, or the broad spectrum antibiotics. But you're creating a vacant sort of ecological niche there, the opportunities will come in, and then you get problems. So the mechanisms that we're talking about here are about building immune fitness. So it's kind of like going to the gym. If you try to do something too hard, too early, it's going to break your muscles, whatever. But if you build up your immune fitness, you become more resilient to some of those infections that will come along. So by having animals, in very clean, hygienic environments, and dosing them with antibiotics as well, you're creating a problem down the track.
One of the earlier slides we had talked about the shedding of microbiota, each and every one of us. We've been in here an hour. We shed about 30 million an hour. There's 30 of us in the room. That's 900 million microbes that we all shed in this room. And they didn't just fall on the floor. We're breathing them in. And we have to remember that. It doesn't matter where we go. Our built environments are the most sterile environments, and that's where the opportunism comes. So bringing nature back into the cities, back into our buildings, this rewilding of the cities, it's a health improvement agenda, and I think it's